Motion. I'm Bobby Olden, and I'm today here with Jennifer, and she has 30 years of nursing experience. Jennifer, what are you going to be teaching us today?
Today we're going to work on active range of motion of our lumbar region in our back. Okay, so our first active range of motion exercise, we're going to need a chair or a bench, something that doesn't move. Because what you're going to do is you're going to stand with your feet apart, a little bit apart from the chair so that you're not bending over. And you're going to pretend like you're sitting, but you're not going to sit. You're going to go up and down. Your arms can go wherever you'd like. You're going to do weight. If you get here and you need to sit, you can. Okay, with the same chair that you used before, you're going to sit in the chair, and I hope you can see this in the chair, but you're going to start. You want to be looking forward. You want proper posture with your lower back slightly arched. I don't know if you can see that. Then you're going to slowly slump the low back, flattening the low back. I don't know if the camera is going to capture that. I'm going to give it a little extra push. And then return back to your arched position. You want to roll forward, flattening your low back, and then straighten back up. Okay, we're back to using our firm chair again. You're going to sit firmly in the chair with both hips planted. Your feet are slightly spread apart with your knees apart. You're going to take your hands, palms down, and you're going to bend forward until you feel the pull. Tilt your head down to the ground at the same time. That way you do not strain your neck and your upper cervical area. You're going to stay in this position for approximately 20 seconds. At the end of 20 seconds, you just roll back up to a seated position. Again, you just roll, hold. You can feel the stretch. Hold for 20 seconds. Sit back up. And we're back with our firm chair. You're going to sit with your knees close together this time, and you're going to reach for the opposite side. So we're going to reach for this side with this arm. You can take your other arm and hold the chair just for stability, and you're going to keep your hips straight in the chair. Again, your buttocks does not leave the chair. And you're going to lean forward, and you'll feel the stretch of your lumbar region. Again, your goal is not to touch your ankle, touch the ground. You're reaching. You stay in this position for approximately 20 seconds. Come back to center after your 20 seconds and repeat on the other side. When you've done that for 20 seconds, you come back to the center. You're going to repeat that side to side. Once again, we're with our firm chair. This time you're not going to sit all the way in the back. You're going to sit about halfway in the chair with your buttocks firmly in the chair. You're going to start just like this with your legs a little bit apart. Knees can be together or apart. That doesn't matter. You're going to take your chin and look up and push your chest out and curve your lower back. Your hands can stay on your knees. Feel that? And then you're going to put your feet out together, and you're going to round your lower back, and your hands are going to go towards your ankles. You're going to keep your hands here, but I'm trying to show you how right here you're arching. You're going to hold this position for about 20 seconds. If that's too difficult, you can limit it to less seconds. That's fine. You can even come up a little bit to modify this. The goal is to keep the rounded lumbar area to stretch. Then bring it back to this position. Chin up and flex and arch your lower back again. And then you're going to repeat this. Go back down. Reach. Make sure to curve your lower back and hold this for approximately 20 seconds. I would like to add on this particular exercise that when you take your feet out and your toes are pointed up, you can be straight like that, which I have a difficult time with due to knee surgeries. You can also bend your knee a little bit and reach. You want to get them as straight as you can for comfort, but you can modify it for those who are unable to straighten. Like that. Okay, this next set of exercises again involves a chair. It could be a stool of some type. You just have to have something that doesn't move again. And because I can be a little clumsy, I like to make sure I have a firm surface next to me. You're going to take your right leg first and place it in the chair. You're going to face your knee. You want to make sure you're straight on. You're going to take your chest forwards to your knee. Your hands, the ultimate goal of your hands is to touch your ankle. Lean forward. Your ankle's right here like this. If that's too difficult, you can start like this and work your way up to this. Once you reach your ankle, you want to hold that position for 20 seconds. If you feel like you're unstable and you might fall, that's the importance of having a wall. So you have something in case you feel like you're going to lose your balance. If 20 seconds is too hard, work up to it. Come back up, take your leg down, switch to your other leg. Same exact movement with the chest to the knee. And go down to your ankle and hold for 20 seconds. Okay, our final exercise again requires a firm chair. You want to sit tall and upright. You're going to need to take your opposite arm, which in this case will be my left arm, and put it in the small of your back. Take your right leg and cross over. You want to make sure you're comfortable, you have enough to kick your foot out just a little bit. Then because your right leg is crossed, you're going to take your right arm and put it just lay it on the inside of your right leg. Take a deep breath in and turn to your left and exhale and hold it for 20 seconds. You're going to sit here for approximately 20 seconds. Again, you can modify this. If 20 seconds is too much, do it for 5 or 10 seconds. You'll work your way up to where you can do for 20 seconds. And come back to a neutral position, and then you're going to repeat on the opposite side. Take your right arm, put it in the small of your back, cross your left leg over, take your left arm and lay it on the inside of your leg. Deep breath in, chest up, exhale, and turn to the right. You can feel the stretch in your lower back and your thighs, which again all support your lower back. Come back to a neutral position. Again, 20 seconds. And repeat.